It's my big honor to share our recent findings on PD-1, PD-L1 blockers against bovine leukemia virus and other chronic infections. Today, I will talk about T-cell response against chronic infections, especially bovine leukemia virus again. And as you know, during chronic infections in cattle, progressive exhaustion of T-cell function is known to facilitate the immunopathogenesis of those chronic diseases. Such disease is, of course, BLV infection, Young disease, anaplasmosis, and mycoplasmosis, and so on. And we are focusing now recently in our project, we are focusing on the molecular mechanism to induce that kind of T-cell exhaustion during chronic infection in cattle. Okay, so look back about PD-1, PD-L1 again. So during chronic infections, persistent antigen stimulation from T-cell receptor or other cytokine stimulation induces upregulation of PD-1 expression on T cells, and cytokine stimulation, such as interferon gamma stimulation, induces PD-L1 expression on infected cells and antigen-presenting cells. And the interaction of PD-1, PD-L1 initiates inhibitory signal into T cells and reduces their effector functions and goes to exhaustion. And as I said, T-cell exhaustion is a common mechanism of immune evasion of chronic infections of cattle, including BLV, Young disease, anaplasmosis, and mycoplasmosis. But fortunately, this exhaustion is reversible. So if we have nice blocking antibody, we can interrupt the interaction of PD-1, PD-L1 and reactivate the function of exhausted T cells. Therefore, we believe the PD-1, PD-L1 could be a therapeutic target for various chronic infections in cattle. But before we start this project, the little information is available on PD-1, PD-L1 about chronic infections in cattle. So first of all, and I also would like to talk about BLV infection again. So BLV belongs to the family of the Retroviridae, which infects bovine B cells and causes B-cell lymphoma after a long latent period, basically 3 years later. And the immunological characteristics of this infection is the T-cell exhaustion in line with disease progression. And there are no vaccine and therapeutic method against BLV. So we focused on what's going on the exhausted T cells during BLV infection. So first of all, we analyzed the PD-1 expression on T cells in BLV-infected cattle. And we divide the cattle into 3 groups: BLV uninfected, BLV positive but no lymphoma, and BLV positive with lymphoma, called EBL. And collected lymph node cells, PBMCs from blood, and analyzed the PD-1 expression on flow cytometry. So as you can see here, CD4 positive T cells from BLV uninfected cattle shows few PD-1 positive populations in CD4, but you can see so many PD-1 positive T cells from CD4 positive T cells of the lymphoma animal. And in total, we found that PD-1 expression on T cells from CD4 positive and CD8 positive T cells from lymph node, and also CD4 positive T cells from the blood, was upregulated in BLV-infected cattle with lymphoma. And then we established our in-house anti-bovine PD-1 rat monoclonal antibody and evaluated the effect of the T-cell reactivation in vitro. So PBMCs were collected from BLV-infected cattle and stimulated with peptide mix of BLV envelope protein and also BLV bovine PD-1 rat monoclonal antibody, and evaluated T cell functions and synthesis of the BLV protein in vitro. So as I shown here, the CD4 and CD8 positive T cell proliferation were successfully enhanced by PD-1 blockade, and also interferon gamma production, mainly from T cell, were upregulated by PD-1 blockade. And most importantly, BLV-GP51 protein synthesis was inhibited by PD-1 blockade in vitro. So based on those in vitro data, with PD-1 blockade restored T cell response to BLV in vitro. Okay, let me have a short summary of our in vitro analysis. So during BLV infection, PD-1 expression was upregulated, and it contributes to T cell exhaustion in BLV infection. Unfortunately, the blockade of those pathways using specific antibody, in this case PD-1 specific monoclonal antibodies, it restores effective function of the cells in vitro. So then we got new hypothesis, that is, the blockade of those pathways using anti-PD-1 antibodies prevents disease progression into chronic infection of cattle, basically BLV infection. So as Dr. Maekawa talked in his previous talk, we developed our specific monoclonal antibody in rat. And rat antibody is recognized as heteroantibody in cattle and eliminated as heterologous protein, and it's also so immunogenic in the body. That's why we engineered those antibodies to chimeric type of the antibody. So the component is completely same as PDL1, but we used anti-PD-1 rat monoclonal antibody variable regions and bovine IgG1 subclass with some mutation to reduce ADCC activity. And we suspect this antibody is more effective in vivo, because this is not eliminated so easily and should be less immunogenic. So we prepared those antibodies using mammalian expression system. So our anti-PD-1 chimeric PD-1 chimeric antibody was successfully expressed in the stable cell line, and after cloning of the stable cell lines, we found that we can produce this kind of amount of the antibody in this cell expression system. And then chimeric antibody was purified from supernatants of the cell culture using protein G or A reagents. Then we checked the function of our chimeric antibody. First of all, I analyzed the binding ability of PD-1 chimeric antibody to PD-1 overexpressing cell lines. So as you can see in blue histogram, binding ability of PD-1 chimeric antibody was similar to that of the original monoclonal antibody from rat. And as a double-check experiment, we also performed Okagawa analysis using Okagawa tip immobilized with bovine PD-1 soluble protein. And in the table, you can see the no difference between a KD value, which showing the affinity of the antibody to the protein. In other words, engineering of anti-PD-1 antibody from rat to chimeric type did not affect the binding affinity to PD-1 protein. So as a final in vitro analysis, we evaluated the blockade effect of the interaction using chimeric antibody. soluble PD-1 protein were pre-incubated with chimeric antibody and then reacted with PD-L1 overexpressing cell line. And as I shown in blue line, chimeric antibody blocked PD-1, PD-L1 binding at the same level of that of the original monoclonal antibody. So finally, we analyzed the pilot clinical study of this chimeric antibody using BLV-infected calf, 4-month-old Holstein male, and we inoculated virus experimentally, and after getting the persistent infection, we inoculated PD-1 chimeric antibody. Firstly, we analyzed T-cell proliferative activity against BLV antigen. We collected PBMCs from inoculated animal and stimulated with BLV antigen or control antigen, and analyzed with flow cytometry. So as you can see here, BLV antigen showing red stimulate BLV-specific CD4 positive T-cell response just after the inoculation of antibody. And then we analyzed the BLV proviral load in this animal using real-time PCR. And we found that the treatment of chimeric antibody significantly reduced the proviral load in the peripheral blood. So those data suggests PD-1 blockade prevents disease progression in BLV infection in this animal. So let me wrap up my talk. We established anti-PD-1 chimeric antibody, and this antibody retains same biological functions and that of the original rat antibody. And based on our in vitro and in vivo data, we believe PD-1 immunotherapy is promising strategy for the regulation of antiviral T-cell response in cattle. And we hope our study could contribute to the prevention of the disease progression of BLV infection. So for the next step, we will conduct additional clinical trials, such as a larger number of BLV-infected animals in the different herds or farms as a field trial. And also, we're interested in other chronic infections, such as mycoplasmosis, Young disease, and plasmosis. So we believe those studies will contribute to broad specific method against various chronic infections in cattle. Thank you very much.
Okay, thank you very much for Dr. Okagawa.